Okay, this will be the final video on binaural and bilateral considerations in hearing aid fitting. We'll start with deciding on bilateral versus unilateral fitting. While we do know that most hearing aid users are going to do better with 2 hearing aids compared to 1, we also know that a small percentage of those users will experience binaural interference. And for that population, the unilateral fit may be the best bet. But for those fit with 2 aids, what do they prefer? So to clarify here, for this last question, I don't mean will they perform better, but I'm saying when you fit a population with 2 hearing aids, will there be a preference for one, even if there is bilateral benefit? So there are actually many studies that have looked at preference for 1 hearing aid versus 2, dating back quite a few years. But those ranges reporting bilateral preference have been from 32% to 93%. So an incredibly wide range, so wide as to not really be terribly useful. But if we look at the 3 largest studies, not the 3 most recent studies, but the 3 studies that have the largest ends, the largest samples, we can see that it's actually clustered. The bilateral preference rates actually cluster together quite closely, 78, 76, and 78% in the 3 largest studies conducted to date. When I first read that, I found that pretty surprising that it did cluster so closely, and I thought it to be pretty impressive too. So if I was just going to give my opinion on that, then I would say that because those 3 largest studies seem to cluster so closely together, it seems to be a pretty good bet. Those are probably some of the best approximations of what a bilateral preference rate would be amongst a population being fit with bilateral hearing aids. I find it interesting to note that these bilateral preference rates of 76 to 78% are possibly coincidentally line up quite closely with some of the more recent data on bilateral fit rates. So in this graph here, we can see that over the course of several decades, the bilateral fit rate has gone up dramatically to closer to present day. We're right at between 70 to 80%. So does that mean we're, exactly on target, or is it more of a coincidence? We don't really know the answer to that right now. So when we ask patients why they prefer two hearing aids or bilateral fit, when they actually do give that preference, why do they prefer it? They report communication and clarity in noise, communication in quiet places, sound quality, decreasing awareness of tinnitus, kind of oral balance or hearing balance, sense of balance between the ears, comfort. I'm sure you probably have had experiences during your residency so far, whereas some patients who, if one hearing aid breaks down, they'd prefer not to wear either one of those hearing aids until the broken hearing aid is repaired. And you may also encounter some patients who really only want a unilateral fit in the beginning, even though because they only report unilateral tinnitus. And as soon as they put a hearing aid on the ear with more pronounced tinnitus, that tinnitus perception shifts to the previously the ear that they didn't seem to have tinnitus in. So bilateral hearing aid fits will oftentimes reduce awareness of tinnitus overall. But for those patients who prefer a unilateral hearing aid fit, when you ask them why do you prefer a unilateral hearing aid fit, they might report convenience. So not really having to deal with changing the batteries and cleaning for 2 hearing aids, only having to deal with 1. Comfort, well, only physically having to feel a hearing aid in 1 ear. Sound quality. Wind noise, well, of course, if you have 1 hearing aid versus 2, there'll be less wind noise. There's fewer microphones for that wind to blow on. Self-consciousness, if this may relate to having others being aware of their hearing aids in their ears, so they may be self-conscious about the appearance of the hearing aids or the presence of the hearing aids. And so 1 versus 2 could be appealing for those who prefer unilateral fits. Reporting that really the non-aided ear is really either too good to need a hearing aid or too bad to benefit from a hearing aid. Or they may also just report that 1 aid is good enough. The amount of benefit they get from 1 hearing aid is satisfactory to them, that they don't need a second hearing aid. So it would be nice if we had the ability to predict who's going to choose a bilateral fit versus who's going to choose a unilateral fit. Unfortunately, the audiometric predictors are not very good. Their ability to predict who is going to be a bilateral, who's going to choose a bilateral fit is very poor. Although we do know that those who have a little bit greater loss and hearing disability will be more likely to prefer bilateral or pick bilateral, but the difference is not huge, not a very powerful predictor. Asymmetry, so audiometric asymmetry is also not a good predictor either. These are some factors that are non-audiometric that typically influence choice of a bilateral fit, though. Those who are a bit older, so over 75 years old, are less likely to accept a bilateral fit. Those who have better binaural processing are more likely to accept a bilateral fit. So, for example, those who do not evince binaural interference. So maybe those who have greater degrees of binaural loudness summation would be more likely to prefer a bilateral fit. Those who have the greatest unaided disability more likely to accept bilateral fit because they get that extra reduction in hearing disability. So this, just like there's nothing that we can use to predict who will choose a bilateral fit, there's also no test for us to be able to predict who will do better with 2 hearing aids rather than 1. We know a small percentage of those with asymmetrical hearing loss will do better with 1. We also know that, and those are typically with larger asymmetries. We also know that there's a small percentage of persons fit bilaterally who will have binaural interference, and an even smaller percentage who have binaural interference that outweighs the benefits of head diffraction, so those who will not see the bilateral advantage in day-to-day life. So there are those population, a small subset of the population who will do better with 1 hearing aid, or at least very much in a larger set than that, even though would prefer 1 hearing aid. We know that most patients with moderate to severe loss are going to obtain a pretty significant bilateral advantage, maybe on the order of 5 dB signal-to-noise ratio improvement, which can be up to 50% improvement in speech understanding and noise. It can definitely make or break understanding conversation in a difficult listening environment. We know that bilateral aids will also provide improved horizontal sound localization. We also know that while audiometric asymmetry reduces that bilateral advantage, it does not eliminate it. Remember, binaural squelch will remain, while binaural redundancy will probably be eliminated. For those patients that we see most often who have mild hearing loss in both ears, so whenever we fit somebody bilaterally and their hearing loss in the better ear is no worse than a mild loss, they may only notice that bilateral advantage when there's very soft input levels directed at what would be the unaided ear if we're comparing that bilateral condition to a unilateral condition. So bilateral benefit is not all that great by any means when we have mild losses, especially when it's a bilateral open fit. Bilateral advantage is most likely to be evidenced when the person has experience in these dynamic listening situations, when they're listening to multiple talkers. So they may report that in terms of reduced listening effort. So not as likely to see improvements here with horizontal localization and improvements in noise when there's single talker. We can say that in order to pick bilateral versus unilateral hearing aid fitting for a client, a trial is the best way to decide. But when talking to the client, some other information here may be helpful when counseling them about the choice between a bilateral versus unilateral fit. It's fairly reasonable to believe that 2 hearing aids will be better than 1 in most conditions. This is not just true with newer hearing aids. This has been true with hearing aids that have been dating back several decades. We know typically we'll see a greater reduction in hearing disability regardless of age, regardless of hearing loss. We can also inform clients about what would happen if they chose unilateral and shifted to bilateral hearing aid fitting later on. We can inform them sometimes this can be difficult because there'll be 2 different acclimatization periods, one going from 0 hearing aids to 1 hearing aid, and another acclimatization period going from 1 hearing aid to 2 hearing aids. Also the possibility of auditory deprivation occurring, and then on top of that, the possibility that those deprivation effects may not be resolved or may not be mitigated when you've added the 2nd hearing aid. Then also technological advances. This is pretty important for the most recent hearing aids that have ear-to-ear communications. This would be coordination of volume controls, coordination of compression, coordination of adaptive features like directional microphones, feedback management systems, and noise reduction, and then in particular coordination of or ear-to-ear streaming as well. So with telephone programs or for super directivity, for some like Phonak or Unitron products, I believe has super directivity. So there's many hearing aids out there that provide features or advantages when you have a bilateral set where these advantages are not present in a unilateral set for the same technology level. Dylan brought up a good point in his text in this chapter about simultaneous versus sequential fit of bilateral hearing aids, and he mentioned some advantages and drawbacks, and at the time of the printing of this text there was no study on it. Well, actually just fairly recently there was a publication in the American Journal of Audiology by Lavi and colleagues looking at simultaneous versus sequential bilateral hearing aid fitting to see what effects occurred from these two different methods. They looked at 36 participants, and they had three groups. They had a group who was fit simultaneously, a group who was fit sequentially, right ear then left ear, and a group fit sequentially left ear and then right ear. And they looked at them following 1 month, following 2 months, and they looked at compliance rates. So high compliance, fair compliance, and poor compliance. I think the most noticeable thing from this figure is that you can see at around 1 month, there doesn't seem to be any large difference between any of those three groups. But at the second month, you can see compliance rates for the two sequential groups both dropped quite a bit. So we see fewer high compliance and more both fair and poor compliance subjects that fall into those categories. So it seems that there is greater compliance when there's a simultaneous fit rather than a sequential fit. Okay, and just real briefly, I want to talk about the effect of bilateral versus unilateral fitting on electroacoustic prescriptions. In particular, NAL, NL2 is what we have some information here on. On average, the NAL NL2 will prescribe 4 dB more gain for mid-level inputs compared to the bilateral conditions. You can see here around approximately around 60 or 65 dB. It's roughly 4 dB more gain for average conversational inputs compared to the unilateral condition. You can see the gain difference is going to be smaller at softer input levels, going down to 2 dB for the softest input levels. Those are typically levels that are really below compression threshold or near compression threshold. And then for the highest input levels, it looks like it gets up to about 6 dB. There's not necessarily any change in prescription for SSPL 90 or OSPL 90. It's also worth mentioning this figure is assuming there's not an asymmetry between the left and right ears in the bilateral fit. Asymmetry would impact the difference that you would have in unilateral versus bilateral gain. And that wraps up this section on binaural and bilateral considerations in hearing aid fitting.